Everyone, can you hear me so that we can start this session now? So again, as I told you, this is another session that is targeting FMG 2021 examination. So we are targeting this examination and we are targeting it with again solving the anatomy MCQ. So what I want to do for the revision of the coming FMG examination, which is going to happen in December. So for that, I want that the entire important topics should be covered by the month of November. So November month तक सारे important topics हो जाने चाहिए. So we will have this cavernous sinus in detail, and this we have to cover up. So cavernous sinus in detail, I want to cover. So for that, what you have to do, I will firstly teach this topic, and then I will also have an MCQ session related to this topic at the end of 15 to 20 minutes. Mein, all the important MCQs related to this topic. So one of the topic just now I have completed. Those who have missed out the session of 6:15 p.m. So all of you do see the 6 p.m. session. Sorry, it's not 6:15. अभी मैंने जो session लिया था वो 6 p.m. का session था जिसमें सारे cranial foraminas discuss किए. तो you just go through that, and now I will discuss the cavernous sinus, because if I am targeting FMG examination, cavernous sinus is a very important topic. Myself, Dr. Monalisa, and I have done my MD Anatomy from Armed Force Medical College, Pune, and I'm here to revise anatomy with you. This is my code. If you want to take the subscription of Unacademy, use this code and get 10% discount. Okay, so that is very useful for you. And I also want to tell you about the unlock code of Unacademy. So use the code ANAT10, unlock the session, and be present for the free live session. That will be highly beneficial for you. I also want to tell you about the special class features. What are the special class features? It's an interactive live session. Okay, it's an interactive live session. And if we talk about an interactive live session, what happens? It's a session in which you can interact with the it's an interactive session where there is an interaction between the educator and the learner. So polls are conducted. Okay, the learners, and in between the learners and the educator, polls are conducted. So raise your hand, you can ask your doubts, and when you, for example, you start listening my session and you liked my session and you want to attend my session, so what you can do, you can follow me on the Unacademy app, and thereafter you will get all the relevant you will get all the notification regarding the session. Lecture notes and PDF notes is provided to you. So after completion of session, you will get the lecture notes and PDF notes provided to you anytime, anywhere. Read from the top educators of Unacademy platform. So this is the code ANAT10 which can be used by you, and this is the unlock code which can be used by you. As an unlock code also it can be used. So I also want to tell you about the free special class. So what are the features of free special class? So we are targeting anatomy session second, anatomy session first. So 7:15 p.m. is the timing for this session, and one is the 6 p.m. which is completed. So do join and see the session. I also want to tell you about the benefits of plus courses. So okay, access both live and recorded version and study from the top educators of Unacademy platform, all 19 subjects. So in the plus course, सारे जो 19 subject है वो बहुत systematic way में complete किया जाता है, so that it is these plus courses are taken by the top educators of Unacademy platform in the field of medical profession. So what will happen? You can target your exam with a better rank, learn from the top educators of the Unacademy platform, compete in live tests and quizzes, and for that you will understand what is your weak area. So for competitive exam में अगर अच्छा rank लाना है, तो most important point क्या है? हमें अपनी weak areas के बारे में पता हो. We know which subject needs more revision and more attention. Study from the device of your choice at your place with your coffee beside and tea beside, and learn from top educators. Solve more than 25,000 MCQs made by the top educators based on the latest pattern examination. And coming soon, what is there? That is the printed notes will be provided to you. Soon there is printed notes coming up. Actually, it's already arrived also. You will get the printed notes if you take the subscription of Unacademy for more than 1 year. Use the code ANAT10 and get 10% discount. My dear students, I also want to tell you about the iconic subscription. So when I'm talking about iconic subscription, it's a merging of both the Prep Ladder and Unacademy group. यहाँ पे Unacademy और Prep Ladder both group का merge हुआ है. So you get the benefits of the plus course of Unacademy. So the plus course of Unacademy is merged with the with that of the prep ladder. Okay, so this is called as iconic subscription, where you get the benefits of iconic subscription. That means clinical integrated sessions are there, video recorded lectures of dream team of the prep ladder can be assessed, QBank 3 can be assessed, rapid revision snapshot, treasure dreams 2021 dream notes will be provided to you. So all these benefits will be catered by you, and this is how it proceed. And this is what I suggest, that if you are going for your preparation of a targeted examination, go for iconic subscription, grab this opportunity. Two best platform benefits can be taken. Use my code NAT10 and get 10% discount. Okay, now my dear students, 25,000 and more MCQs based on clinical pattern of questions from all 19 subjects. Explanation of each and every MCQs is given by the top educators, so just grab it. Okay, before starting the session of today's and the topic, I want to share an important information with you. That information is a scholarship of 1 crore rupees. Okay, a scholarship of 1 crore rupees can be availed by you if you are going to give 10th October 11 AM combat test. That is Neet PG combat test. So till 200 rankers, so till 100 to 200 rankers will get the scholarship test, and do present for this. Rank 1 to 3 will get 1 year of Neet PG plus subscription. Rank 4 to 10 will get 75% scholarship subscription. 11 to 50 will get 50%, and 51 to 200 ranks can grab the opportunity of getting 25% of the scholarship test. So just grab this opportunity. This is highly beneficial for you. 1 hour test, 45 MCQs. Okay, exam date is very near. Which exam? INICT is coming up. Okay, so what to do? Do present for the grand free test on the Unacademy platform. 17th October is the date, 2 PM to 3 PM. Get enrolled by using an NAT10 code. Oh, I am very glad to share the Neet PG September batch 2021. So these examination, very glad to share, and I'm very proudly sharing the photographs, and I want to congratulate them. They have performed so nicely. So all the best for their coming future. I also want to tell you about the batch courses, which is starting from 6th October, Focus FMG batch, Miss and INICT batch, Target Neet PG 2022 batch, Clinical Case Discussion batch, Instrument batch. All these batches, you can use the code NAT10. So I also want to tell you about the Neet PG subscription. So for Neet PG subscription, what you can do, अगर नीट पीजी सब्सक्रिप्शन की बात करें तो आई एम शेयरिंग दिस where the comparison of iconic and plus is given. So the comparison of iconic and plus is done, and here what you can see that if you are the students of first or second year, go for 4 years of subscription. If the target is next INICT, Neet PG next, or FMG, just target in the first year 3 to 4 years subscription you can take. In the final year, pre-finals, 1 or 2 years of subscription. Use my code NAT10 and get 10% discount. So all the best. Let's start with the session. Now the topic which is very important, what I have seen in the previous trend, जो topic आपके लिए बहुत important है. Okay, welcome everyone. Sonu, Deepak, Deepak, Ram, Nisha, Hitesh. So everyone, so I will tell you about the cavernous sinus and how I am going to correlate with the topic. The topic will be done in a following way. First, I am going to target the location and the extent. उसके बाद मैं relations बताऊंगी. Then I will also tell you the structure which is passing through it, and tributaries, communication, and the clinical anatomy. And at the end, I will discuss few MCQs, the MCQs related to the topic. So this is how we are going to cover up all important topics of anatomy before your exam day. Okay, so let me just zoom this diagram. Here you can see the cranial cavity, this yellow color structure, which I have highlighted with a red line, which I am encircling it. That is the location of cavernous sinus. That is the location of cavernous sinus. Okay, this is the location of cavernous sinus, and approximately it is 2 centimeter in length, 1 centimeter in the width, and it is located in middle cranial fossa. It is located in middle cranial fossa. Okay, this is located in middle cranial fossa, as you can see here, and it is lying on either side of the body of sphenoid. So which bone is this? Actually, you can see here, this is the body of sphenoid bone, and on either side of this, if I use this color yellow only highlight, this is the location of cavernous sinus on either side of body of sphenoid. Okay, so location kahan hai? Where is the location, dear? Location is along the sides of body of sphenoid. It is along the sides of body of sphenoid and along the sides of body of sphenoid and sella turcica. Got it? Sella turcica. Along the side, okay, along the side of body of sphenoid and that of sella turcica. Now, I also want to tell you about what is inside. So, when we are talking about cavernous sinus, जब हम cavernous sinus की बात करेंगे, तो why it is called as sinus? What is the reason of formation of cavernous sinus? Actually, we know that in case of cranial meninges, we have got outermost dura, then we have got arachnoid matter, and then we have got pia matter. So these are the three layers which is passing from outside to inside. Okay. So actually, okay, from outside to inside, we have got the layers, and cavernous sinus, if you will see the interior of it, it is divided. The interior of the cavernous sinus is divided into small spaces or caverns. So what you will see, interior is divided into small spaces called as caverns, and this is divided by trabeculae. So the name which is given to it, it's cavernous sinus. So the name is cavernous sinus. Now, as I told you, what is the reason of formation of cavernous sinus? Cavernous sinus क्यों बना है? So it is formed by splitting off. It is formed by the splitting of two layers of dura mater, that is endosteal layer and that of meningeal layer. So yes, the reason of formation of cavernous sinus is splitting of two layers. So just see here. So it is splitting of two layers. So when I am talking about the floor of cavernous sinus, it is formed by endosteal layer of, dura matter. अगर cranial dura matter की बात करें तो उसमें कितने layers होते हैं? The cranial dura matter is made of two layers. The floor is formed by endosteal layer of dura matter, my dear. And when we are talking about medial wall, when we are talking about lateral wall, and when we are talking about the roof, okay, so medial wall, lateral wall, and roof. When we are talking about these three structures, medial, lateral wall, and the roof, these three structures is formed by the meningeal layer of dura mater. It is formed by meningeal layer of dura mater. It is formed by meningeal layer of dura matter. Got it? Now coming to the extent. Now coming to the extent. Okay, so when we are talking about cavernous sinus, as you can see here, this is the cavernous sinus, and when we are talking about the extent, it extends. So this is the whole. This is the middle cranial fossa. This is the sphenoid bone which you are seeing here. This is the whole sphenoid bone. On either side of sphenoid bone lies the cavernous sinus, as you can see in the middle cranial fossa. In the middle cranial fossa, cavernous sinus. So extent may anteriorly it is extending. So this is what? This is lesser wing of sphenoid. This is lesser wing of sphenoid, and just below lesser wing of sphenoid, the structure which is residing here, this will be the superior orbital fissure. Okay, ये क्या होगा? Superior orbital fissure. See here also written this. Here will be the location of superior orbital fissure. So what you can say, the extent is from superior orbital fissure, posteriorly it is. So this is anterior, A for anterior, and this is P for posterior. So posteriorly it is extending to the apex of petrous temporal bone. It is extending to the apex of petrous temporal bone. It is extending to apex of petrous temporal bone. It is extending to apex of the petrous temporal bone. Got it? Now coming to the, so please write down this point also, extent, and then we will move on with the relation topic. Okay, so here please write down. Okay. Extent of cavernous sinus. So from where to where it is extending? So when we are talking about extent, anteriorly it is extending from, the anterior extension is anteriorly it is extending from medial end of superior orbital fissure. . and posteriorly it is extending to apex of petrous temporal bone, apex of petrous temporal bone. Okay, anterior and posterior extent. अगर anterior and posterior extent की बात करें तो anteriorly from the medial end of superior orbital fissure posteriorly to the apex of petrous temporal bone, posteriorly to the apex of petrous temporal bone. Okay, anteriorly medial end of superior orbital fissure, posteriorly the apex of petrous temporal bone. Okay, so yes, now after that let me tell you about the relation. So next topic is the relation. So it is important to know the important relations in respect to cavernous sinus. So let me explain the same thing in the diagram, and thereafter I will write the things for you, don't worry. So this is the schematic diagram to make you understand the relations of the cavern. So in this diagram, can you see this whole outline of blue area? All of you can clearly see this whole outline of blue area. What is this? This is the cavernous sinus which is lying on either side. So if I talk about the relation, superiorly it is having, this is internal carotid artery. Superiorly it is having internal carotid artery, and close to it will lie the optic chiasma. Okay, medially pituitary gland. If this is cavernous sinus, medially is pituitary gland, and this is the sphenoidal air sinus. SS for sphenoidal air sinus. So medially pituitary gland and sphenoidal air sinus will lie. And if we talk about its lateral aspect, this is the temporal lobe. This is the temporal lobe which is lying on the lateral aspect anteriorly, as we have seen in the extent. So anterior and posterior end we have already seen in the image, where you have seen the anterior and posterior extension. So anteriorly it is extending to the apex of superior orbital fissure, posteriorly to the apex of petrous temporal bone. So this is the important relations. Okay, so first important relation, then the structures traversing. So please write down, because these relations are also important for you. So relations of cavernous sinus. Superiorly it is related to optic chiasma. Superiorly it is related to optic chiasma, optic tract, internal carotid artery, and anterior perforated substance. Anterior perforated substance. Okay, superior. So superior is that superior relations में क्या बोलेंगे? Superior relations में, if we talk about the superior, so that is optic chiasma, optic tract, internal carotid artery, and anterior perforated substance. Now coming to the second one. This is about the superior. Now coming to the second one, the inferior. When we are talking about the inferior relation, so inferiorly it is having inferior relation. Inferiorly what structures is related? Inferiorly it is related to foramen lacerum, junction of body and greater wing of sphenoid, junction of body and greater wing of sphenoid. What happened? Anyone not understanding? So my dear aspirants, the target of the session is to complete firstly the introduction of the topic and then MCQ related to the topic. So what I want, actually different students are of different level. So some students just want MCQ session because they have gone through it. So in between I will just make MCQ session. Some students want a quick revision of this important topics before the examination. तो maximum benefit होने के लिए हमें क्या करना है? I will explain the topic in the brief, which is very, very important for that target examination. Then MCQ related to the topic. So just now I have taken one session just before, वहां पे cranial foraminers बताया, उसके बाद MCQs related to the topic. Abhi cavernous sinus I will explain in another 15 minutes, 15-20 minutes, and then I will take 15-20 minutes for MCQ discussion. So these way we can cover the entire thing for your exam, FMG exam targeting before your examination. INICT session ke liye MCQs will be on the YouTube session. I will take few on a special class also, and Neet Pg 22 ke liye bhi I will take the session more on the YouTube and few on the special class session. I will let you know. Don't worry. Please let me know, is this okay, or any suggestion. So those who are live, they can interact with me. They can write their message and just tell me what is the best option which you want from me. So actually, the learners are the best one who want who will tell me that what they exactly want, because I thought that this will be better. So you just let me. You can write in the message. So inferiorly foramen lacerum, junction of body and greater wing of sphenoid, the medial. Now coming to the medial relation. In the diagram, we have clearly seen medially कौन सा structure था? Pituitary gland. Which gland? Pituitary gland. What is the other name of pituitary gland? It is also called as hypophysis cerebri. And that of sphenoidal air sinus. And that of sphenoidal air sinus. The second one is sphenoidal air sinus. Got it? This is medial relation. This is inferior relation. And we have done with the superior relation. Now coming to the lateral relation. So we have done with superior, inferior, medial. What remains? Lateral. What is related laterally, my dear aspirants? Temporal lobe of, and that is containing the uncus part of cerebral hemisphere, This is lateral relation. Okay. Now anterior and posterior. What is anterior extent? All of you are still knowing. Please tell me, those who are remembering, that what is the anterior extent? Anterior extent is superior orbital fissure close to the apex of the orbit. Okay. My dear aspirant, what is the posterior extent? Crux cerebri of the midbrain. Posterior extent is crux cerebri of the midbrain. Okay, got it? And also it is related to the apex of petrous temporal bone. Apex of petrous temporal bone. Got it? Apex of petrous temporal bone. Tesa 9. Okay, 9. Tesa 9. Tesa, I'm not understanding. What do you mean by word 9? What you want to ask? 9? I can't understand 9. You want 9 a.m. p.m. session? Let me know. I'm not, please write the entire thing. I'm slightly confused, Teja. Okay. So now I want to tell you that what structures are mistake, ma'am. Okay, it's okay, dear. It's okay. Okay. So, okay, let's discuss the topic quickly, and then we will discuss the MCQ related to the topic. Now, in the cavernous sinus lateral wall, few important nerves are residing. Okay, so let me show you the few important nerves residing here. So yes, I will erase these things. I will enlarge this diagram, and here are the nerves which is residing in the lateral wall of cavernous sinus. So let me just highlight this. These yellow color structures which is lying inside, these are all cavernous sinus. So firstly, let me show you the structures residing in the lateral wall from above to down. So the nerves are oculomotor nerve, trochlear nerve, abducent nerve. Got it? Abducent nerve. Also we have got, so actually abducent nerves are here. Abducent nerve is not lying in the lateral wall, but it is passing to and fro. Can you see here? Abducent nerve and internal carotid artery. So these structures are piercing the cavernous sinus. Okay. So if you concentrate on the diagram, you can see abducent nerve and internal carotid artery. This is passing through and through the cavernous sinus, and maxillary ophthalmic is also residing in the cavernous sinus wall. So let me tell you the structures lying in the lateral wall and passing through and through. So coming to that point. So all of you write down structures present in the lateral wall of the cavernous sinus. The nerves are oculomotor nerve, third cranial nerve, trochlear nerve, fourth cranial nerve, ophthalmic nerve. Ophthalmic nerve means ophthalmic division of trigeminal nerve. The other structure is maxillary nerve. Okay. So these are the nerves which is residing, lying in the lateral wall of cavernous sinus. The next important point is passing through and through. The structures which is passing through and through the cavernous sinus, and the structures are internal carotid artery. The structures are internal carotid artery. Structures are internal carotid artery, sympathetic plexus around the internal carotid artery will also traverse an abducent nerve. Abducent nerve. Actually, the location of abducent nerve is lying when it is passing through the cavernous sinus. Abducent nerve is passing below one ligament. Anyone remembers what is the name of the ligament below which abducent nerve is passing? Anyone remembers the name of the ligament is petrosphenoid ligament. Petrosphenoid ligament. The name of ligament is petrosphenoid ligament. Petrosphenoid ligament. Again, important for MCQ. Now coming to tributaries of cavernous sinus. So I would like to describe this diagram where you can appreciate the tributaries and the communication. So my dear aspirants, if we talk about tributaries of cavernous sinus, there are three sources of tributaries. These are direct tributaries of cavernous sinus, and the direct tributaries of cavernous sinus are from the source of orbit, superior ophthalmic vein, inferior ophthalmic vein, central vein of retina. Superior ophthalmic vein, inferior ophthalmic vein, central vein of the retina. From meninges, sphenoparietal sinus and middle meningeal vein. Sphenoparietal sinus and middle meningeal vein. From the brain, it is superficial middle cerebral vein and inferior cerebral vein. Superficial middle cerebral vein and inferior cerebral vein. Got it? These are the tributaries of cavernous sinus. Okay, three sources are there, and communications are both the side cavernous sinus is communicating with intercavernous sinuses. Draining channels are superior petrosal sinus and inferior petrosal sinus. Inferior petrosal sinus will drain the cavernous sinus into internal jugular vein. Superior petrosal sinus, transverse sinus, basilar plexus of vein, emissary vein, pterygoid venous plexus. So my dear students, I would like to give you the list of all the tributaries and communications of cavernous sinus. So these are all important for MCQ. So quickly, let's revise and then we will come up with the MCQ session. So write down tributaries of cavernous sinus, the direct tributaries. The tributaries of cavernous sinus is from following source: orbit. What is the name of the vein? Superior ophthalmic vein. Inferior ophthalmic vein. Superior ophthalmic vein, inferior ophthalmic vein, central vein of retina. Central vein of retina. These are the sources from the orbit. The second source is from the meninges. So from the meninges, the source are sphenoparietal sinus. Sphenoparietal sinus. Anterior frontal trunk of middle meningeal vein. Anterior frontal trunk of, anterior and frontal trunk of middle meningeal vein. Middle meningeal vein. Got it? Anterior or frontal trunk of middle meningeal vein. So these are meningeal source. The third source of tributary is, so okay, one more, the third source. What is the third source, dear? Brain. Brain is the third source. Can you tell me the source of the vein? What is the name of the source of the vein? This is brain. So the source of vein is, the name of vein is superficial middle cerebral vein. Superficial middle cerebral vein. Superficial middle cerebral vein. Then is inferior cerebral vein. Inferior cerebral vein. Okay, superficial middle cerebral vein, inferior cerebral vein, orbit में superior ophthalmic vein, inferior ophthalmic vein, meninges में sphenoparietal sinus, anterior frontal trunk of middle meningeal vein. So these are the tributaries of cavernous sinus. These are the tributaries of cavernous sinus. Got it? Now coming to communications of cavernous sinus. Next is communications of cavernous sinus. So the communication of cavernous sinus is via following route. So transverse sinus. So it communicates with transverse sinus via superior petrosal sinus. What is the communication? The communication route is superior petrosal sinus. My dear aspirants, all these communication tributaries has been asked so many times in your examination, in your entrance exam, in your NEET and your FMG's exam. So just revise it. Internal jugular vein. It also forms communication with internal jugular vein via inferior petrosal sinus. Inferior petrosal sinus. It also forms communication with pterygoid venous plexus. Pterygoid venous plexus. And the communication of pterygoid venous plexus is possible via emissary vein. Via emissary vein. My dear aspirants, I have told you these emissary vein is passing through various foraminas like foramen ovale, foramen lacerum, and sphenoidal emissary foramen. All these foramen se ye pass karta hai, and it is forming communication with that of pterygoid venous place and cavernous sinus. Other than that, it also forms communication with the facial vein. Actually, the facial vein communication is done by two routes. One is via ophthalmic vein, superior ophthalmic vein. I am writing in short form, superior ophthalmic vein, via angular vein, via facial vein. Got it? So how the cavernous sinus is forming communication? So we directly know cavernous sinus ka direct tributary kaun sa hai? Superior ophthalmic vein. Superior ophthalmic vein forming communication with angular vein forming communication with facial vein. Other route is via emissary vein. So emissary vein is forming communication with cavernous sinus. Emissary vein will communicate with pterygoid venous plexus of veins. And it will form communication with deep vein. It will form communication with deep vein, that is facial vein, and via facial vein. It also forms communication with the opposite cavernous sinus. So coming to communication, the fifth communication is, it is forming communication with the opposite cavernous sinus. What is the source of forming communication with opposite cavernous sinus? Intercavernous. Absolutely right, Kaustup. You are absolutely right. The communication is via intercavernous. Absolutely right. Intercavernous sinus. Okay. Can anybody tell me the communication to superior sagittal sinus, triple S, the communication of superior sagittal sinus. Cavernous sinus communicate with superior sagittal sinus via, what is the route? Superficial middle cerebral vein. The communication is via superficial middle cerebral vein. Superficial middle cerebral vein. Now, intervertebral venous plexus. Now, the next is question number 7. It also communicates with intervertebral venous plexus, via basilar venous plexus. Now, my dear students, we have done with the communications, we have done with the tributaries, which is quite evident in this diagram also. Next, what is important is to know the applied anatomy. So, yes. So, after this, few communications also you can see here. This is the cavernous sinus, which is shown here. This is the cavernous sinus, and what you can see, this cavernous sinus is forming communication via spheno. These are tributaries: superficial middle cerebral vein, sphenoparietal sinus, inferior cerebral vein, central vein of retina, ophthalmic vein. Then is the communication via emissary vein, pterygoid venous plexus, facial vein. Facial vein communicating with deep facial vein. And the infection from danger face area will be communicating with pterygoid venous plexus and cavernous sinus. So all these you can clearly see. All these you can clearly see is forming the route of communication and the tributaries in this case. Now let's talk about the applied. The another diagram which is showing the communications of cavernous sinus is shown here. So you can see here. Okay, let me use this cavernous sinus. Okay. It is forming communication with superior petrosal sinus, inferior petrosal sinus, inferior cerebral vein, pterygoid venous plexus via emissary vein, and all these facial veins, supraorbital, supratrochlear will drain into ophthalmic vein and will form communication with cavernous sinus. So these two diagrams are very beautiful diagram, anatomically correct, showing you the whole communication of cavernous sinus. MCQs will be asked as direct communication. So my dear aspirant, direct communication का मतलब होता है direct tributary. Indirect communication means certain interconnecting veins. So can you tell me the case? Which case is this? Which clinical case is this? This is a case of, which clinical case is this? Yes, thrombosis, cavernous sinus thrombosis. This is the case of cavernous sinus thrombosis. Absolutely right. This is the case of cavernous sinus thrombosis. And the reason is due to numerous communication. The reason is due to numerous communications. The reason is due to numerous communications. These connections has been formed, and actually one of the most important route of communication is, see here, septic emboli is drained from the danger area of the face. Danger area of the face. So just below the nose and region above the lip, upper lip, this area is the danger area of the face. So infection from the danger area of the face is drained to facial vein. Then it is drained to deep facial vein. It is drained to deep facial vein. From deep facial vein, it goes to pterygoid venous plexus. It is draining to pterygoid venous plexus. And my dear aspirants, pterygoid venous plexus se kahan gaya? Emissary vein mein reside hua. It goes to emissary vein, and through emissary vein, it is drained into cavernous sinus. So got it? How it was traversing? Infection from danger vein, communicating to facial vein, then communicating to deep facial vein, then communicating to pterygoid venous plexus, then communicating with emissary vein, and then communicating with cavernous sinus. So this is how the whole sequence of infection transfer is being seen, and this causes cavernous sinus thrombosis, which is a very grave condition. And my dear aspirants, what will be the clinical sign and symptoms? If you remember, which all nerves are lying in the lateral wall and in the cavernous sinus. So all the nerves which is giving blood supply to extraocular muscle, third cranial nerve, fourth cranial nerve, and sixth cranial nerve. So that means third, fourth, and sixth cranial nerve is involved. So what will be it causing? It is causing ophthalmoplasia. Ophthalmoplasia. Severe eye pain. Swelling hoga, severe eye pain in the forehead and the eye due to involvement of ophthalmic nerves. Also, the reason is involvement of ophthalmic nerve, severe pain. Okay. Other than that, marked edema. The patient will have marked edema as shown in the diagram, exophthalmos. See here, the patient is having marked edema, exophthalmos. The patient is having exophthalmos, congestion of, also congestion of orbital veins is seen, congestion of orbital veins. So these are the clinical sign and symptom which will be represented in the patient. Now, my dear friend, one more important applied anatomy I want to discuss, then we will move on with the MCQs related to the topic. In case of fracture of base of skull, in case of fracture of base of skull, agar base of skull ka fracture ho gaya, so what will happen? If the base of skull is fractured, yes, periorbital edema caused it. Absolutely right, periorbital edema. Now, if you remember, cavernous sinus के अंदर कौन सा artery traverse कर रहा है? Which artery is passing through cavernous sinus? Which artery? Internal carotid artery. Yes. So internal carotid artery is passing through it. As we know, this internal carotid artery will form communication with, it will form communication with cavernous sinus. So what is cavernous sinus? Cavernous sinus is a dural venous sinus. That means an artery is forming communication with a vein. So means much forceful. Yes, corticocavernous fistula. Okay, AV, it is called as arteriovenous communication. It is called as arteriovenous communication. Okay, and here the force of blood will increase in cavernous sinus, and the clinical symptoms will be pulsating exophthalmos. Pulsating exophthalmos hoga. Patient is having much more blood supply in a better force, so it will cause a loud bruit that is causing systolic murmur. Ophthalmoplasia will be seen. Conjunctival edema, and marked orbital edema. This will cause marked orbital edema. Okay, and my dear friends, ophthalmoplasia to hoga hi, third, fourth, sixth nerve is involved. So this will be again another sign and symptoms which will be seen in the patient. Okay, so these are all clinical aspects. So have you understood the topic? So what is very important for you to know is the relations of cavernous sinus, structures traversing through the through lateral wall. You have to know the communication, you have to know the applied part, clinical aspect, you have to know the tributaries. So after this, let's start with the MCQ session related to the topic. And I also want to know from the students who are listening right now, before starting the MCQ session. So before starting the MCQ session, what I want, okay, I will come to the MCQ. So for you, for the students who are targeting the exam, so for FMGE students, I am taking special free sessions. So the mode of my teaching will be important topic discussion in brief, and then MCQs related to the topic for the entire month of October and November, so that we can cover most important topics. So this is the target which I want to go through, and so in the week 3-4 sessions I will take. So is it okay with you? And evening sessions will be there. So are you okay with you, or anyone wants to give me suggestions? INICT and Neet Pg 2022 aspirants MCQ session discussion will go on the YouTube channel, few on the special class. So let me know, is it okay with you all? Can I proceed like this? Okay, so yes, it's okay. So let's start with the session now. All the best, students. So let's start with the session now. MCQ. Cavernous sinus receives blood from all of the following except superior, inferior petrosal sinuses. So tomorrow is Thursday evening also I will take a session. Okay, last 2-3 minutes we will discuss that. Don't worry. Superior, inferior petrosal sinus, superior ophthalmic vein, inferior ophthalmic vein, superficial middle cerebral vein, or sphenoparietal sinus. So let me know which is the correct answer. Your time starts now. Okay, just let me know which is the correct answer. Okay, cavernous sinus receive blood from all of the following sources except. Your time starts now. Okay. Okay, so yes, many students has given the answer as I am seeing here. Few students. Okay, the correct answer is superior inferior petrosal sinus. Question number 1. Superior inferior petrosal sinus. Why superior inferior petrosal sinus is the correct answer? Superior inferior petrosal sinus is a communication. It's a communication. Okay, it's a communication which is formed actually through superior inferior petrosal sinus. It is communicating with transverse sinus and that of internal jugular vein. If you talk about other option like superior ophthalmic vein, inferior ophthalmic vein, superficial middle cerebral vein, and sphenoparietal sinus, they are direct tributaries. So they are direct tributaries of cavernous sinus. Okay, got it? अगर हम other options की बात करें, that is superior ophthalmic vein, inferior ophthalmic vein, superficial middle cerebral vein, sphenoparietal sinus. So all these 4 options are actually direct tributaries, but superior and inferior petrosal sinus is communication. Through this communication, cavernous sinus is draining into internal jugular vein and transverse sinus. So this is the correct answer. So through superior petrosal sinus, transverse sinus, through inferior petrosal sinus drains into internal jugular vein. So we have got A as the correct answer. It is not the direct tributary. So it is not giving directly blood to cavernous sinus. All other options are direct tributaries. Got it, everyone? Let's move on to the second. Cavernous sinus receive blood from superior ophthalmic vein, inferior ophthalmic vein, superficial middle cerebral vein, and sphenoparietal sinus. Explanation is also written, so you will get the PDF. After the completion of session, you can download the PDF and thereafter you can have the revision also. Let's start with the second MCQ. Okay, anyone didn't understand? So let me know. Which nerve is not contained within the cavernous sinus? Optic nerve, oculomotor nerve, trochlear nerve, trigeminal nerve, abducent nerve. According to you, which is the correct answer? Which of the following nerve is not a content within the cavernous sinus? Your time starts now. Question number 2, mark the correct answer. Okay. So optic nerve is the correct answer. The correct answer, all of you do participate in the poll. Many of the students are live, but few students are only participating in poll. So you can give the answer, nothing to worry whether it is right or wrong. Optic nerve. So optic nerve is correct answer. Why? I will tell you. So it is not contained within the cavernous sinus. We have got third cranial nerve. We have got fourth cranial nerve. We have got fifth cranial nerve. Actually, the branch of fifth cranial nerve is ophthalmic division, which is lying along with its sixth cranial nerve. So all these are lying in the cavernous sinus, as we have seen. Optic nerve किससे traverse कर रहा है? Which area? Can you give me the answer? Optic nerve is traversing through above the roof. Optic nerve passes through which foramen? My question is, optic nerve passes through which foramen? Optic nerve passes through which foramen? Optic foramen. Yes, absolutely right. It passes through optic foramen. Just a minute, I have to fix. Okay, so it passes through. Okay, just a minute, I'm just connecting. Okay, so yes, optic nerve passes through the optic foramen along with ophthalmic artery. Along with ophthalmic artery, so A is wrong option. It is not content, all others are the content. So this cavernous sinus contains internal carotid artery, its branches, carotid plexus, sympathetic nerves, oculomotor nerve, trochlear, trigeminal. Occasionally, at times in some of the book, occasionally maxillary hai, nahi to abducent nerve hai. Occasionally you can write. So coming to question number 3, take your time, 30 seconds you can take. You can read the option nicely. Which of the following is correct? Actually, which of the following is correct? So it is also related to cavernous sinus topic. Actually, meninges or sinus ka question hai. Take your time, read the option. Superior sagittal sinus runs superior to brain in the inferior border of flux cerebri. Inferior sagittal sinus is formed by union of superior sagittal sinus and great vein and joins confluences of sinus. Transverse sinus follow S course in the ultimately drains into internal jugular vein. Occipital sinus lies in the convex attached border and attaches to crista galli. Cavernous sinus is situated on either side of sella turcica. So in this explanation also, I have given the right answer when I was taking the session. So accordingly, mark the correct answer. So take 30 seconds and mark the correct answer. For question number, this is question number 3, dear. Just a minute. This is question number 3. Okay. जितना बड़ा क्वेश्चन है आंसर उतना ही छोटा है. आंसर बहुत सिंपल है, बस क्वेश्चन बड़ा है. Okay, so my dear aspirant, the correct answer is E. Cavernous sinus is situated on either side of sella turcica. No doubt that this is the correct option. Just now, I have explained it, cavernous sinus, and I have told you about the location. So this is absolutely correct answer. Cavernous sinus is situated on either side of sella turcica. So this is absolutely correct. Okay, absolutely correct hai. Superior sagittal sinus runs superior to the brain, inferior free border. No, it is not running in the inferior free border, but it is running superiorly. Okay, inferior sagittal is formed by union. Actually, inferior sagittal is running in the inferior flux cerebri. Transverse sinus drains and It is superior petrosal sinus drains into transverse sinus. Inferior petrosal sinus will drain into internal jugular vein. Occipital sinus is in the convex attached border of cerebral flask. Okay. So this is also not correct. And don't worry, meninges ki bhi class honge. So if you are confused with this option, again there will be session on meninges in brief, and then again I will tell you the topic of meninges. So here the correct option is E, that is cavernous sinus is situated on either side of sella turcica. Cavernous sinus is situated on either side of sella turcica, and as I told you, the extent of cavernous sinus is from superior orbital fissure to petrous part of temporal bone. Now let's move on to the next. So this is a very simple question. Don't get worried. Okay, meninges भी मैं explain करूँगी in brief because meninges के भी questions आए हैं FMG के examination में. So it is related to the flow of CSF. It is also very simple. I will give 30 seconds for this question. So you just mark the correct answer. What is the flow of CSF? So 5 options are there. So read the option nicely. I will give you 30 seconds. All of you take your time and read the option nicely, and then I will mark the correct answer. Okay, got it everyone? 30 seconds I will give you, and then you mark the correct answer for question number 4. Okay, so many of the students has marked it right. Okay, many of you have marked it right. Very good. The correct answer is the CSF flow is from lateral ventricle, then interventricular foramen of Monro, then third ventricle, from third ventricle cerebral aqueduct, then the fourth ventricle, from fourth ventricle medial and lateral apertures, and then subarachnoid space. So this is how, and this is the correct flow of CSF. Lateral ventricle, interventricular foramen of Monro, third ventricle, third to fourth ventricle via cerebral aqueduct. Fourth ventricle के roof में 2 openings होते हैं. What is the name of that 2 opening? The 2 opening which is lying in the roof is median and lateral aperture, and from lateral and medial aperture it will reach into the subarachnoid space, and subarachnoid space is containing cerebrospinal fluid. So B option is perfectly right, and many of you have given the right answer. Yes, that is called as foramen of Mazenday and Luska. Absolutely right, Kaustubh. Foramen of Mazenday and Luska. Absolutely right. So cerebrospinal fluid from lateral, interventricular, third, cerebral aqueduct, fourth, and finally into the subarachnoid space. Let's move on to the next. That is question number 5th. Which nerve does not contribute innervation to dura mater? Which of the following nerve is not giving any kind of innervation to dura mater? Means of the following option. So ophthalmic division of trigeminal nerve, maxillary division of trigeminal nerve, mandibular division of trigeminal nerve, 7th cranial nerve, C1, C2 and C3. So according to you, which is the correct answer? Question number 5th, mark the correct answer. Okay, so many of the students has given the right answer. So 70% students has given the right answer, and the correct answer is 7th cranial nerve. If we talk about the innervation of dura mater, it is by ophthalmic division of trigeminal nerve, it is by maxillary division of trigeminal nerve, it is by mandibular division of trigeminal nerve. So these 3 nerves, ophthalmic, mandibular and maxillary division of trigeminal nerve, is contributing to the innervation of dura matter, and along with it also first, second and third cervical nerve, but not the facial nerve. So facial nerve is not the correct answer. Now see here, dura mater innervation nerve supply is done by all the three divisions of trigeminal nerve, that is ophthalmic, maxillary and mandibular. So that was given in the option, no doubt about that. And also C1, 2, C2 and C3 nerve, possibly also by vagus. Please note down, vagus nerve is also contributing. So if we have to choose one, we will go with facial nerve. Then we will go with which answer? Facial nerve. Now, before ending the session, I would like to tell the students I have started the FMG session, free session today. Those who have missed out, please see the session. It will be highly beneficial. What I want, so all the link of the session will be provided in the Telegram group. You can use this code ANAT10 and get 10% discount if you want to take the subscription. Also, it can be used as an unlock code. It can be used as an unlock code for unlocking the free sessions on the Unacademy platform. And I also want to tell you about two sessions today, 6 p.m. sessions. The first session for the revision of anatomy for the FMG students, and 7:15 p.m. session is the second session for the anatomy revision, as we have seen. And Neet PG Combat is there. So you will get 1 crore rupees pool from which you can achieve you can achieve rank till 200 rank. You can achieve from rank 1, 2, 3, 4 till 200 ranks. Rank 1 to 3 will get 1 year of Neet PG subscription absolutely free. Rank 4 to 10 will get 75% of the scholarship. Rank 11 to 50 will get 50% of scholarship, and rank 51 to 200 will get 25% of the scholarship. So 10th October is the day, 11 a.m. is the timing. Grab, get enrolled by using the code ANAT10. Use the code ANAT10 and get enrolled for the Neet PG Combat. For the Neet PG Combat, all the best students. So do join there, because a high opportunity is there where you can grab the scholarship amount, and all the best. So 1 hour test, 45 MCQs. Okay, students. So I will come up with a few more topics of targeting different examination. Those students who want to be present and revise, those who are the aspirants of INICT examination, many clinical MCQ sessions, I am uploading the videos in the month of October. I have started, so you can revise that all in a very systematic way. Also for the Neet PG 22 preparation, I have started the revision of entire anatomy in a systematic way. So you can again join me on the YouTube session. Few topics of entirely MCQ session, revising INICT and Neet PG examination, I will take on special, and FMG more sessions on the special classes. So do join, participate. First the topic explanation in the brief, and then MCQ session, so that we can cover up, because every student not only directly want to jump on MCQs, they want to know the topic also. So quick revision of the topic and then solving the MCQ. So all the best, keep studying. Is it okay, everyone? So tomorrow also I will take in one evening session. Is it okay? So one evening free session for the FMG part 3. So what timing do you want? What timing which will suit you? Let me know. Tomorrow if I take the session, let me check. Maybe evening, 6 p.m. is okay. 6 or okay, 6 p.m. So yes, that will be okay. So we can target at 6 p.m. because I think 7:30 p.m. maybe that no, tomorrow is 7th. No, tomorrow is 7th. So okay, 6 p.m. or 7 p.m. Okay, I will just give you the link on the Telegram group, either 6 or 7 p.m. Is it okay? We can also have the session that is on 7 p.m. or 6 p.m. So 7 p.m. session, that will be the third session of FMG targeting anatomy examination. So like that, we can cover up the entire course. This is my code which can be used. If you want to see the session free, you can use it as an unlock code. Okay. So all of you be present for the 7 p.m. session. That is the part 3 of the free session targeting FMG examination 2021. All the best. Thank you so much. Thank you. We will meet tomorrow. We will meet tomorrow. Thanks. All the best, students. Thank you.